My name is Neil Halpern. I'm the Director of Critical Care Medicine at Memorial Sloan Kettering Cancer Center in New York. And more importantly, I am the Director of the ICU room at the Intelligent Hospital Pavilion at HIMSS 2014 in Orlando. It is my pleasure today to show you some of the highlights of our ICU room, focusing on healing environment, patient safety, and high-tech healthcare informatics platforms brought to the patient to provide excellent patient care. One of the most critical elements in taking care of the ICU patient is to provide a proper environment. And a proper environment starts with privacy for the patient. There are several ways in which privacy is currently applied. That can include curtains, double pane glass with blinds, or more preferably eGlass. In fact, curtains may get dirty and need to be changed in between patients. Blinds in between double panes of glass may also break and need to be repaired. However, eGlass, which is right in front of me and is controlled by the nurse inside the patient room, provides wonderful privacy for the patient at the touch of a button.
A lot of people walk in and out around the ICU. How do we provide privacy typically? We use curtains. Curtains are very problematic. They get dirty, they have to be cleaned, they get contaminated, and then they're changed and they don't match the ICU. So there's another approach, and that is to use eGlass. And on the right, you see what a typical eGlass panel looks like. It looks like a typical window pane. However, powered off, as this is, it's opaque. Powered on, copper wires that go around the perimeter, it turns clear. So the eGlass provides privacy at the touch of a switch, easy to clean, less infection, of course, than curtains, no curtain changes, no loss of floor space.